Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. We'll be discussing Crohn's disease. Crohn's disease is an idiopathic chronic inflammatory bowel disease, IBD, characterized by transmural inflammation that can affect any part of the gastrointestinal tract, from the mouth to the anus. It results in ulceration, stricturing, constriction, contraction, fistula, or abscess formation. Classification by location. Ileocolic Crohn's affects both the ileum and the colon. Crohn's ileitis affects only the ileum. Crohn's colitis affects only the colon. Classification by behavior. Inflammatory. The disease is caused without stricture of the fistula. Stricturing. This is the narrowing of the lumen, which will lead to bowel obstruction or changes in the caliber of feces. Penetrating. The disease creates an abnormal passage between the bowel and the skin. Causes and risk factors. Cause. Idiopathic, unknown. Risk factors. Familial or genetic predisposition. Environmental factors, e.g., diet, stress, smoking, use of NSAIDs, neurological disorders influenced by inflammatory cytokines. Pathophysiology. In Crohn's disease, genetic susceptibility combined with environmental triggers leads to an abnormal immune response against intestinal microbiota. This causes chronic transmural inflammation, resulting in the characteristic clinical and pathological features of the disease. Signs and symptoms. GIT symptoms. Abdominal pain, lower right quadrant. Diarrhea, possibly bloody. Weight loss, nausea and vomiting. Systemic symptoms, fever, fatigue, anemia. Extra-intestinal symptoms, joint pain, skin rashes, eye inflammation, uveitis, liver disorders. Diagnostic testing. Blood tests, CBC, CRP, ESR. Stool studies to rule out infection. Colonoscopy with biopsy. Imaging, CT scan, MRI enterography. Capsule endoscopy for small bowel involvement. Medical management, pharmacological. Aminosalicylates, mesalamine. Corticosteroids. Immunomodulators, azathioprine, methotrexate. Biologic therapies, infliximab, adalimumab. Antibiotics, for complications. Non-pharmacological. Dietary modifications, nutritional support, e.g., enteral nutrition. Stress reduction, nursing management. Monitor for complications, bleeding, perforation. Assess pain, hydration, and nutritional status. Educate the patient on medication adherence and diet. Emotional support and coping strategies. Prevent infection during immunosuppressive therapy. Surgical intervention. Indicated for complications or treatment failure. Procedures. Resection of diseased bowel segments. Strictureplasty. Fistula repair. Note: surgery is not curative. Disease may recur elsewhere. Complications. Intestinal obstruction. Peritonitis. Fistula formation. Abscess formation. Nutritional deficiencies. Colon carcinoma in long-standing Crohn's colitis. Diagrams and visuals. Insert labeled diagrams. Affected GIT areas. Pathophysiology steps. Imaging, CT, endoscopy. In conclusion, Crohn's disease is a lifelong, relapsing inflammatory condition of the GIT with systemic involvement. Early diagnosis and comprehensive management are essential to improve quality of life and prevent complications. Are there any questions or points you'd like me to elaborate on? Feel free to ask. What lifestyle changes would you recommend to someone newly diagnosed? Great question! I would recommend starting with dietary changes, focusing on avoiding trigger foods, ensuring adequate nutrient intake, and incorporating regular exercise to help manage stress and maintain good health. How critical is regular monitoring for a Crohn's patient? Regular monitoring is essential. It helps in identifying any complications early, managing symptoms effectively, and adjusting treatment plans as needed. It's a partnership between the patient and the healthcare team.